It was presented this morning, was presented the results of the GA101 plus Bendamustine group of patients, because it was a subgroup of the GREEN study, and patients treated in first line with the G-Benda, and the results are as follows. The complete remission rate is quite high, about 40% in the patients. And regarding the MRD results, the MRD is negative in almost all the patients in the blood in response, and in about 50% of the patients in the bone marrow. But it is a very preliminary data because the follow-up is quite short in this trial. So we are waiting for the PFS because it's too early for the PFS. And the other major concern is the toxicity of this trial, because we have a very high rate of patients with neutropenia grade 3-4, but it's not translated in infection. I think that it was for patients who are unfit, for example. I think that it could be a good option as a GA101 plus chlorambucil in first line or in relapse, because we have a high CR rate and a high MRD negative rate. The presentation of this trial in 70p deleted patients in relapse, it will be tomorrow morning in the ASH meeting. It was a late-breaking abstract, and we have a very high rate of overall response rate, about 90% of the patients. Very few patients are in CR, but the follow-up is quite short too. And of note, there are not very severe tumor lysis syndrome. It was a major concern of ABT-199 at the beginning of the trials, but now it's only some biological TLS, but no clinical TLS. So I think it's very important data. And in those patients with a very poor prognostic, the response is very good. I think that the major challenge is to use this drug in the real life. I think because we have to be very cautious regarding the side effect of ABT-199. It's a very effective drug, but if you start with a very low dose and escalating dose, you can cope with this problem of TLS. And the other concern is the neutropenia rate, grade 3-4, but the toxicity is very manageable now. I think the next step is to combine ABT. You have some data in the combination of ABT with GA101. It was shown this morning at the CLL session. And also to combine with other oral drugs, such as BTK inhibitors, because it's not the same pathway, and you can inhibit two pathways in the tumor cells, the BTK pathway and the PCL2 pathway. So I think it will be the next step of this combination.